All right, everybody. We're live here, and thank you for joining our webinar on implementing Oura Ring in concierge practice. We're going to kick things off here, and I'm going to just start by sharing my screen. All right. Can you guys see this okay? Anyone just give me a
Yep.
quick verbal? Yeah?
Yep. Yes.
Okay. All right. Great. Welcome to our webinar today on integrating Oura Ring into concierge practice. Thank you for joining us. Our agenda for today, just to walk you through what we're going to cover, is first we'll just start with some introductions on our panelists. And also, we have some of our subject matter experts in the chat who are answering questions. So we'll introduce everybody here in a moment. We'll introduce Aura and we'll introduce Heads Up. And then we're going to look at how do you actually implement Oura Ring into a clinical practice. We're going to look at a few specific case studies of how this is being done within different types of concierge practices, from professional athletes to weight loss to diabetes management. So we'll look at a few case studies. Then we're going to have Dr. Jake Deutsch tell us about what he's doing at Oakwood Precision Medicine. And he's got a very sophisticated concierge practice integrating a lot of high-end digital health coaches, and using the data to its full potential. So we're grateful to have Dr. Jake here to share his expertise with us. And then we'll have an opportunity, if you want to learn more, you can schedule a discovery call. And then if you're still with us at the end, we're going to pick one winner and we'll give away an Oura Ring. We'll get in touch with you. We'll get you a sizing kit and we'll get you a ring. So that's our agenda here today. We'll start with some quick introductions. I'll start us off. My name is Dave Korsunski. I'm the founder and CEO here at Heads Up. And our company exists really to help make outcomes measurable in concierge, integrative, and precision medicine. We're working with a lot of different data sets. We're working with sensors and wearables. We're working with diagnostic tests. We're working with biological age testing. So we're doing a lot of different types of measurement in concierge integrative medicine. And what I saw was a real need to build the tools to actually measure that it's working for each individual, but then also make sure that it's working across an entire cohort of people. So we're effectively a data analysis, measurement, and engagement platform. And we'll show you exactly how that's working in practice. I know it's a lot of buzzwords. So I've got some specific examples I'll show you of how this works today. And then also, of course, we have Dr. Jake here to share more. So let's do some intros with the rest of the panelists. Let's go with Dr. Lemansky, and then Jason, and then Dr. Jake. If you guys could do a quick hello for everybody.
Yeah, sounds good, Dave. Thanks everybody for joining us. So my name is John Lemansky. I'm the Chief Medical Officer of Heads Up. I've been with Dave for quite a while. My journey started, I was board certified in internal medicine and started as a hospitalist. Found myself to be pre-diabetic, so started kind of going down my own health journey and realized that I was following the wrong guidelines, which were the standard guidelines. So joined kind of the low carb keto space, became a speaker, and met Dave at a one of the talks. And at the time, I was doing a functional medicine kind of hybrid practice, focusing on wellness and prevention. But I didn't have any good way of tracking data. And at the time, I mean, this is like 2016, 2017. There wasn't really anything on the market. So Dave came up at a talk and presented Heads Up, which was vastly different at the time, but basically realized I didn't have to use an Excel spreadsheet anymore. So we became good friends quickly, and then I joined the team as an advisor, investor, and then eventually the chief medical officer. I've been a user of Aura. I'm not a Kickstarter campaign user, but I had the old, big, thick Aura ring.
I
So I've
did
been,
too, the ring pop one.
yes, I called it the pimp ring because it was like pretty gaudy. But so it's come a long way, but been an avid user of Aura for myself and my patients now for quite some time. So excited to talk with Dr. Jake and the team about how to actually implement it into healthcare practice. So
Thanks,
I'll
John.
let yeah, Jason maybe introduce himself.
Great. Hello, everyone. It's really nice to meet all of you. I'm Jason Oberfest. I oversee healthcare strategy and partnerships at Oura. For those of you who don't know Oura, we're a health tracking device. We're worn as a ring on the finger. And for those of you who haven't seen it before, I'm sure you'll see some other folks wearing it today. That's essentially what Oura looks like. The company was founded in Finland a little over 10 years ago. Initially, we had a very heavy emphasis primarily on sleep tracking. And we've really worked very hard over the years to be a very accurate tool for that. But we've also evolved to support tracking many other aspects of daily health. And we'll talk a lot more about that today. I joined the company after 5 years on the health software team at Apple. And I'm really excited to be here today for a discussion on how Oura is being used in care. Thanks, Dave, for having us here today.
Thank you, Jason. Dr. Jake, welcome.
Hi. Hello, everybody. My name is Dr. Jake Deutsch. I'm a physician. I practice in New York City. I have a very interesting background getting to this space as a ER doctor, being board certified and practicing emergency medicine for 20 years. I transitioned a little bit into urgent care space and then an infusion space. But all along the way, I've been kind of doing things for myself, biohacking and optimizing health. And when I decided to open this practice after selling some of those other companies, I decided I wanted to create something that was a platform that made the process approachable and very organized, and really giving people the tools of how to do this same type of medicine that I've been practicing for myself and my close family and friends. So along the way, I've been trying to find the best resources to implement a very high level concierge level of medicine. And so that brought me to Heads Up in order to be a platform to sort of host all of the information. And then, of course, being a user of Oura, it was made natural sense to integrate that into my practice and really sort of being the primary health device that we use to track patients' health, their outcomes and their measures along the way. So I've had lots of great success with both of the products. So hopefully I can shed some really good light onto the topics today and inspire everybody to, kind of make the same choices and have the same success with their own practices.
Thank you, Dr. Jake. We love the way you've put your program together. It's very, very sophisticated and elegant, really just at the forefront of how do we take all of this cutting edge digital health and then apply it in concierge. So thank you for taking time to share your expertise with us today. We do have a few people who will be in the Q&A and the chat answering questions. I just wanted to quickly introduce Katrine. Katrine, can you say a quick hello for us?
Yes. Hello, everyone. Sorry for not running my video. We have not really good reception today. So my name is Katrine. I have been in the health and wellness field for over 20 years. We have been running a decentralized concierge practice for probably 10 years or so. Utilizing wearables, labs, all sorts of ways to connect with clients. So finding Heads Up was essential to be able to connect the practitioners and clients and being able to monitor them from afar. We also have a in-person clinic where we have intensives, 7 to 10 days, using everything from ozone to NAD to all sorts of other technologies. So again, post treatments, it's really great to be able to monitor clients and see who are not our personal concierge clients, but somebody who's been referred by other practitioners, and see how they do with treatments and figure out when to come back for them, how we can improve their care, and how we can share this information with their providers locally. So thank you, Dave, for inviting, and I'm looking forward to answering your questions.
Thank you, Katrine. Katrine's brilliant. So if you have hard questions, you can fire them at Katrine. And then Aaron runs our partnership with Oura. So if you have questions on how to actually get going in your practice and how do you actually get started, Aaron's running the partnership here. Aaron, can you say quick hello?
Hi, everybody. Yep. Just as Dave said, I'm here to support you in getting Oura set up for your practice and answering any questions you have about implementing the Oura program with your practice.
And we also have Chuck on our team. Chuck's our wearables expert. We call him Inspector Gadget because he has anywhere from 7 to 20 wearables on at any moment in time, which means he knows everything about everything. when it comes to different devices, what they measure, how they measure it, what's best. So again, if you have any product or technical questions at all, fire away. Katrine, Chuck, and Aaron will be ready to answer questions for you guys. So just a little bit about Heads Up. I mentioned it briefly, but what I saw within integrative concierge medicine was a lot of amazing data, but there was really no way to pull it all together. We talked to too many practitioners that were using spreadsheets just to try to pull together fragmented labs, pull together fragmented data sets. We saw a lot of really, really valuable data in PDF files, a lot of really valuable data sitting inside of sensors. What was missing for me was the tools that could pull it all together, structure the data, and then help us make sense out of it. So that's what we do here at Heads Up. We integrate data from sensors like a continuous glucose monitor. We integrate data from cutting edge wearables like Oura, from diagnostics, not just blood tests, but like biological age testing, microbiome, urine, stool, all of the more precision level diagnostics come in. We get into individual and cohort analysis. We'll show examples of that. We can build intelligence on top of the data. So for example, if Dr. Jake wants to get notified when someone's heart rate variability has gone down for 7 days in a row, we can start to pull out those signals from the data and make it easy to come in and find exactly what you're looking for. We can integrate with your electronic health record system. We're not trying to replace the EHR. Rather, we're like an add-on module that can do the data analysis that you need. And then we have lots of ways to get data in and get data out. This is the nerd talk here. But if you're interested in ways to get access to the data through API or Lakehouse, there's different ways we can connect to other systems. And then we can white label and customize the software to match your programs and your branding. So that's a little bit about Heads Up. Jason, would you mind? I know you gave us a bit of an intro at the beginning about the history, the amazing history of Oura and the fascinating history of Oura. But if you could take a little bit more time and just share anything about the company for those who are here and are relatively new to Oura.
Sure, I'd be happy to. And I won't take too much time because I'm really eager to get to the heart of the discussion around how we're being used by leading care professionals. But I will say, Aura's been a beloved consumer device for many, many years. We've also been used by healthcare professionals for years who have recognized the value of what we're doing in the context of care. And a lot of the focus of my work now is on making sure we have the right features and services available to those care teams. For those of you who don't know or haven't worn one before, I think the two items I would mention that are particularly unique about what we do is number one, the form factor. The idea that we have comprehensive health tracking worn in this way is very unique. And I think there are a lot of benefits to that. First and foremost, there are many, many people who prefer to sleep with a device like this instead of a wrist-worn device. And so we see our wear time is extremely long, which creates really good streams of data for care professionals who are working with that data. So that's clearly one of the most notable benefits. It also turns out that sampling biometric data here from an artery on the finger is a really accurate place to do that. And we've spent a lot of time as a company validating clinically the accuracy of what we're doing, which is also, of course, really important. I also think, and this is more of a broad point, my experience has been, and I'm curious how the panel feels about this too, that increasingly there are many people who don't necessarily want another screen strapped to their wrist, essentially as a mini smartphone, pinging them throughout the day with stressful news headlines or work messages. And they really prefer the simplicity of a device like this and the passive work that it does to really better understand the individual and help the individual better understand themselves. So that's another key benefit that we've seen over time as far as the Ring form factor. The last thing I'd quickly mention is battery. We run for a very long time between charges, which many people also appreciate as well. They're not fighting for a moment between daytime and nighttime to charge, before sleep. Typically, the ring can run 6 days or more on a single charge. So that's quite valuable. The only other thing I'll quickly mention as far as a fairly unique aspect of Oura from the end user's perspective is I think a lot of wearable technology has been focused on really capturing data and presenting raw data without necessarily a lot of context around it. And one of the things I certainly appreciated about Oura, and I wore Oura for years before I joined the company, was how focused the company was on putting that data into context, helping the user understand it and make sense of it. It isn't necessarily about understanding, you may get an hour of REM sleep each night and an hour and a half of deep sleep, but like, what does that mean for your health? Is that good? Is that bad? How can you improve that? And I feel like that's always been a really core focus and mission of Oura for any of the information that we present to the end user. So I think that's been really unique as well. And as a result of all those things, we've created a really valuable data stream for care teams, and we're learning more and more every day about how care teams are using it. So that's just a little bit about the product itself. What I will quickly say as well is that, we're constantly thinking about ways we can help leading professionals in healthcare get access to Oura data for supporting their members. And we certainly think of Heads Up as a leader in that space. And we're really excited to be working closely with the Heads Up team to make sure that practices who are interested in Oura have access to it. So with that said, I'll turn it back over to you, Dave.
Thanks, Jason. Heads Up has had an integration with Oura for a very long time as well. I think we were one of the first integration partners. So the connection between Heads Up and Oura has existed for over 7 years now. So we've put tens of thousands of people through the system, and it's been incredibly stable and reliable. And I think the most important thing, just to summarize, was the data was so valuable and is so valuable for individuals, and now practitioners like Dr. Jake understand how to use this, and it's making this transition now where we're seeing it in more of a clinical setting, and there's really fascinating use cases on how that's being done, and that's kind of a segue into what we're going to look at next here. So with the introductions out of the way, I just want to give a few examples for practitioners on different ways we're building this in practice today. Oh, sorry, before I do that, I'm a little off key here. This is the program we're launching with Oura, and it's specifically designed for longevity, concierge medicine, and other membership-based healthcare programs. We have the ability to supply rings to your members at a discount of 25%, which results in a very significant cost saving on the hardware itself. We also have an ability through our partnership to deliver a 15% saving on the annual subscription. One of the challenges, though, is still, okay, how do I get all of my patients connected? How do I get the data flowing? How do I get them sizing kits? How do I get them rings? There's a lift required just to even get to a point where you can review the data. So as part of the program, we will help, Heads Up will help with getting sizing kits to your patients, getting them rings, getting them connected to the system, and getting the data flowing. We also have training for your staff, because the staff need to know with the data as well. So it's a complete turnkey solution for concierge practices. And we're just announcing this today. It's available to all Heads Up customers, but it's a great and easy way to get the rings. It's a great way to get the data flowing, and it's a great way to get your practice from 0 to 60 with Oura and Heads Up for concierge. So Aaron is going to be able to answer any questions throughout the rest of the webinar on how this works, how to get started. But I want to say, first of all, thank you to Oura for being such an amazing partner and for making this available to us. I think it's going to be fantastic, and it's going to help a lot more practices integrate Oura and other digital health. So this is our program for concierge practices. Feel free to shoot any questions on this in the chat or the Q&A. We have a quick polling question. This is just going to help us get to know everybody else a little bit better. So let me find the polls here, and I'll bring up the first question. All right, here it is. Can everybody see this? All right, yeah. So we just want to know a little bit about what type of practice you're running. Second question, roughly how many patients are you seeing in practice? And then the third question is, we're really interested in what kind of electronic health record and practice management system you use, mainly because that's the system we at Heads Up and Oura will typically be integrating with as part of the program. So we'll give that another minute here. Let's see, functional integrative coming up ahead in terms of type of practice. Concierge and longevity are a close second. 11 to 100 clients, typical practice size, practice better, and healthy and serbo and other. So clearly we missed a lot of EHR practice management systems on our list there. All right. Give it another 10 or 15 seconds here. Thank you for everyone who participated. All right. Moving right along here. So I'm going to take a few minutes and just share a few examples, and then we'll turn it over to Dr. Jake for the feature presentation here. Everything we're presenting in the next few slides, you can read the full case studies on our website. But SIBA is a really interesting functional diabetes program. And they're using a nutritional therapy protocol to help with diabetes remission, type 2 diabetes remission. They're using Oura, but they're also using the Freestyle Libre continuous glucose monitor, and they're using the Wizings blood pressure cuff and scale. So technically 4 devices. This is a completely virtual program. So all of the patients are monitored from afar. And these devices allow the SIBA providers and the SIBA coaches to calibrate the protocols in real time. We integrated the whole experience inside their EHR, and they're actually starting to be able to very precisely quantify outcomes. This is a program that they offer to health plans. And so showing the outcomes back to the health plan is critical. So because we have all of the data centralized, we can make it very easy for them to show the outcomes back to the plan or back to the employer or back to any organization that they're working with. So what the interesting thing here was it was one of the first type 2 diabetes programs that really saw the importance to understand sleep as a component of metabolic health. And they spend a lot of time helping their patients optimize sleep because they know when the sleep improves, the hormone regulation improves, the ability to self-regulate improves. So it was very interesting to see Oura as a pillar of a metabolic health program. I hope we actually see more of that, where we start to focus on fixing sleep as part of fixing metabolic health. Dr. Jake, Dr. Lemansky, any comments just on sleep as a function of metabolic health?
I mean, I always use the same term pillar when you talk about the 3 pillars of health: diet, exercise, and sleep. So, I totally can agree with that. And this is a great program that's just simplifying all of the different kind of tricks that you can use with the wearables and getting data and, improving outcomes and not even having to touch a patient. That's how powerful data is when it comes to, sort of using these tools and getting outcomes that we're looking for.
Thank you, Dr. Jake.
Yeah.
This one is equally fascinating. Sorry, John, you can chime in on this one here, but this is And Health. They're a functional protocol for autoimmune, and they're working on diet, sleep, lifestyle, stress for autoimmune disease. And they integrate the Oura Ring into the autoimmune program. And they're not using traditional pharmaceutical approaches. Most of the patients coming in are on traditional pharmaceuticals, but they're actually using a very, very holistic lifestyle management approach for autoimmune. I pulled out one example from the case study, and the coach was able to monitor the client's activity levels on the Oura Ring. And what they saw was the activity level starting to increase substantially. At the same time, they started to see the heart rate variability go down substantially. And at this point, the patient had an autoimmune flare and had to start prednisone. And so what they were able to do was show this individual how overtraining. They were on 3 consecutive 30-mile bike rides. But that individual had not really been able to connect overtraining to a decrease in heart rate variability, a stressor, to the point where the stressor led to an autoimmune flare. So this was used, this exact chart was used as a way to educate the patient to say, you can monitor your own heart rate variability. We don't have to do it. And you can monitor your own activities and just taper it off and potentially be able to avoid that same type of situation in the future. So this was a really, really fascinating use case on how can we implement Oura effectively for stress load on the autonomic nervous system or overtraining, and then using heart rate variability as a byproduct of that. Third one is Podium. He's working with Tour de France and PGA athletes, and they're monitoring people at the highest end of human performance, and obviously monitoring sleep, resting heart rate, physical recovery. What we see in sports medicine, they're looking at how hard did the person train, what happened to their resting heart rate and their HRV, and based on that information, should they train harder the next day or lighter the next day? So they're really using these Oura metrics to help calibrate training load. And there's some algorithms we built into Heads Up that automatically crunch the data and automatically compute what that recommendation would be. And then the last one is this supplement company we worked with. They developed a formulation specifically targeted to heart rate variability, which is kind of the holy grail that we're all chasing here, us biohacker nerds. And so this formulation was really targeting HRV, and they used the Oura Ring and also the World Health Organization Wellbeing Score and tested their supplement, and we were able to start to validate efficacy of a product. This could just as easily be validating efficacy of a protocol, but in this case, it happened to be supplement validation. So just a few really interesting use cases of this data in the wild and how it's all being used. So if you have questions on any of those use cases, fire away. We're going to do a quick polling question, and then we'll jump into Dr. Jake on Oakwood. So I'm going to launch poll number 2. I can figure out how to do that. Polls quizzes. All right, here comes question number 2. This is just a little bit about whether you're using Oura in practice today and what types of use cases you'd be interested in if you were to implement this in practice. And then do you already have clients interested in Oura? So we'll give that a minute here. While these are coming in, I'll turn it over to Jake or John or Jason, just anything on those use cases that kind of popped up for you there.
Yeah, I was just going to say, I mean, in terms of metabolic health, I think, sleep now is being recognized a lot more as a key pillar. But, I work with a lot of kind of executives who travel, multi times a day or a month, different time zones, and the impact that you can see on their Oura rings and how that impacts their actual, ability to function is remarkable. And then I work with shift workers, so like nurses, doctors who work late at night. The impact, of poor sleep regulation on their metabolic health is really pretty remarkable, especially if you combine that with like a CGM. So the valuable data that you get from an Oura Ring, especially when you're tracking those metrics, I think if you're trying to do a functional medicine practice, it's essential to have that.
Agreed. Thank you, John. So we thank you for everyone who participated in the survey. I'm going to actually stop the slides now. And what I'd like to do is just have a conversation with Dr. Jake Deutsch about how he's doing things over at Oakwood. So Jake, with that preamble, we'd love to just hear about how you've built your concierge practice. We know you're using Heads Up. We know you're using Oura. We know you're building all kinds of really interesting, valuable analyses for your patients, and you're using this as part of the program. You're engaging them with this data. So maybe you could just tell us a little bit about the program, and then we'll start to fire some questions away on how you're doing things.
Sure, absolutely. I mean, as I mentioned before, we're really focused on prevention, longevity, health optimization, very um, sophisticated clients, people who, for the most part, are kind of looking for this as an approach. And so, when I started to put together what I thought would be important, technology I knew was going to be a key component. So, I kind of went through all of the different devices, which I thought would be helpful. I've personally used all of them. But, what I wanted to try to do was simplify to have one primary device that I would recommend for health tracking. And at least when it comes to these metrics. And so that way, things were unified. When there's multiple different devices, I find that it's a little bit more difficult when you're pulling that data in versus having one that the practice is sort of leaning on. And so that's really why I chose Oura, because I thought it was the most robust. I thought it was the most simple. People really have a easy time adopting to it. And then, the other biggies are going to be the blood pressure monitors and the scales and CGMs. But for the sort of like leader of the pack device, Oura captures all of the different elements that I think are necessary. And if you're setting up a practice like this, or you have an existing practice like this, I mean, I think you really have to understand how important the technology is and having that data. And, you'll find probably kind of two kinds of patients, people who already have this or people who are curious about it. And, you have to be reactive to that. And so, it's helpful as a tool, but also it's helpful sort of as a perspective and a state of mind that people, are kind of looking for as well. So it ensures good data, ensures good outcomes, but it also is really good for the success of your practice is what I found. And as much as, people are a little bit hesitant to sometimes try these devices when they haven't before. I've had the one thing that I can say with confidence is almost everybody who has been introduced to Oura and started using it has ended up liking it. So, that's one of the successes that I see, but there is a little bit of an art to, sort of making sure that it gets implemented. So when we introduce it to clients, we've created fact sheets, like information sheets, and those go into their heads up application so we can share kind of a summary for them of what to expect and what the this will do. Also, we've integrated having the sizing in our office, so that way we can get people sized and kind of familiar with it, and that adds to better success. And then we are really relying on that data every single day, and that's what we're connecting with patients. And so that's sort of like the third point about success, because then people start to understand what we're doing, and they get interested as well. And so when I talk about that data, we aggregate data every day. And, in our dashboard, we have probably 25 different points of data between the CGMs and blood pressure monitors and scales and wearable devices. But then we need a way to take a look at that and then assess how each patient's doing. And so my solution to this was actually, getting somebody who is going to be in charge of that, a medical assistant, whose role is sort of looking at the integrative data and then presenting that in a way so that way when we check in with our patients every week, we're able to then have a conversation based on that information. And so that's been really successful and has really transformed what the process looks like. Because as you can imagine, when you implement using devices like this, turning it on is one thing, but then, utilizing the information and seeing positive results is a whole nother level. And, having the tools and sort of the process in place so that you're getting factual information and being able to present that to the clients really well is very important. So I think that, if you're interested in adding these type of metrics to your practice, you have to have a plan in place in order to implement it. So, that's where Heads Up is great, because it really hosts everything in one spot and the integration is easy. The API is probably one of the smoothest that we've used with. That's the connection between the Oura app and the Heads Up app. And that makes it really easy as well. And then you really have to, I think, be thinking about what it's going to look like to actually assimilate that data. And from personal experience, some people are really into it, some clients, and others less so. But the people who use the data more, who are reactive to it, that seem to be more invested, typically have better outcomes. So that's a win. And that's something that I usually really try to emphasize to people who might be a little bit reluctant from the data side of things.
Dr. Jake, in my own health, I've seen how Oura has led to behavior change for me personally. Just by me looking at some of the numbers in the morning and then connecting that back to, for example, how I slept or maybe what I did the day or the night before. Are you starting to see similar trends where you're seeing people start to learn the behavior changes and start to self-calibrate? And then when you
Yes.
have a coach or a practitioner on the other end, are you able to accelerate that process?
Yeah, so that's when it gets really exciting, because you start to see the client interpret the data. But like I said, we kind of set it up initially where we have information sheets that we've created. We also really have them, lean on Oura's app that has lots of teaching moments and information that they can read. And then each week when we're checking in with them, we're going over the data. Your HRV looks great. What's happening this week? Did something change? Are you doing something? And then, yes, it is inevitable that we start to see them come up with these conclusions and start to then kind of implement changes on their own. And, I always emphasize to people, that's what biohacking is. Whether you like the term or you don't, any behavior we do to change our biology, that's biohacking. And so if you are drinking less and, seeing your sleep improve and then adopting that behavior, that is the process that we're looking for. Or if you're saying, I travel all the time and I need to start looking at, my sleep bank, which is a really great feature that Oura has, so that you can kind of see how much you're ahead of the game with your sleep, then that's, really, I think that's another level that is exciting to see when clients start to implement that information, kind of process themselves. And then they're coming to me and saying, hey, doc, look at this. I now have a resting heart rate when I sleep in the 50s, and, I'm, measuring different levels of success. So that absolutely is a natural evolution that we see.
I think once you get someone to the point where they're identifying and connecting with these numbers, and they're able to come to you and they're able to say, hey, I've got my resting heart rate down this much. And so that aha moment for me, when someone starts understanding their own biofeedback, plus they have you for that next level of interpretation, those I think are the most powerful moments. Or first that own personal aha, like, oh wow, I made some healthy changes and I saw my own numbers get better. That immediate agency you give someone, and you've basically led them there by giving them the tools. But then there's also the need for that next level of interpretation, because interpreting HRV is hard, and we need an expert sometimes.
Right. Yeah. So, I mean, I think that there is definitely a need for somebody to be able to walk people through this. And, just seeing that change for people can really be an aha moment. What I think I always say the concept is that we have a lot of little signals that are reminders of what we need to be doing. And that's what ultimately moves to a positive effect. So, you may not completely understand HRV, but you're thinking about it. And, you get a little experience that you can improve it by doing cold plunges. And now, long term, you might be working on many different things that are adding to improvement in your nervous system. And so the Oura is a great example of how we can have many different ping points that are powerful. And just the same way as like a CGM can be as well. Most of the people that we're applying that to, they're not diabetic, but they learn particular associations with foods and spikes in their blood sugars. And those are little connections that form that ultimately lead to, a stronger fabric of positive outcomes and good health choices and, better wellness. So that's what I really love about it is, it's not just, oh, you slept okay. We have all of this other information and these little reminders And that's why, you know, quite frankly, our process is very involved. You know, we're checking in frequently with them, you know, giving feedback. I'm seeing my clients every 4 to 6 weeks, as an example. And all of that is just reinforcement of behavior, reinforcement of the ideas, you know, using tools that are positive and encouraging, you know, I think is part of that process too. And those all add to the end result that we're looking for. So it's really, it's coming from the background of being an ER doctor, where you saw the end stage and people's, you know, sort of worst moments. It is incredibly satisfying to be working with people and see the preventative and success, and, you know, sort of the wellness side of it. So, you know, I highly encourage people to add as many of these type of integrations into their practice as they can.
Well, Dr. Lemansky, you spent your fair share of time in ER medicine as well, so I assume you can relate to that.
Yeah,
just being able to see both sides of the spectrum.
Yeah, Jake and I will have an off topic discussion about ER and hospital medicine doctors talking to each other. But no, I mean, I think the key takeaway really that I see is you're changing the conversation. It's not like a punitive conversation between a doctor and a patient. It's actually a very positive conversation. You know, you're able to use data because, as Dr. Jake mentioned, there's a lot of data. I mean, there's so much data now. It's how do you take that data? How do you actually package it so that it makes sense to people? And then how do you pair that with lifestyle changes to create like a positive feedback loop, which I think if you can do that and you can engage your patients or your clients to make better decisions. And even when people make, let's say, bad decisions, go out, have a party, like that's not a necessarily negative outcome. That can be used to really show, look, when you do this, this is what's going to happen. And this is why you feel the way you feel. And so it's another positive reinforcement that I think really builds a good relationship between a doctor and a patient. I don't know about Dr. Jake, but when I was in hospital medicine, you know, you don't have like the kind of interaction with the patient, that long-lasting relationship, and definitely not an ER. And I think most doctors, or maybe not most doctors, but crave that kind of relationship that you're building as well, to where the patient is almost like a family member. And so you're in this journey together to improve people's health and keep them out of the hospital, keep them away from the ER. And that I think is really what medicine is about. So it's really inspiring to hear Dr. Jake's kind of take on things. And I'm sure his patients are doing fantastic because of using the data this way.
Yeah, thank you. It is really a different connection. And, you know, being able to share data with clients, be able to communicate. Like sometimes my clients will just send me a screenshot of like a great outcome, right? You know what I mean? Like they hit 2 hours of deep sleep or something, you know, and they're just sending me that, you know? And so, yeah,
I would send that.
But, you know, like that's such a cool interaction to have with a patient, versus, you know, sitting and seeing them one time and, you know, talking. And so what I think is really important is having the platform like Heads Up provides, so that way you can, you know, see that information and it's reinforced. You know, lab results is such a big thing. Most people get printouts and they're flipping through papers. They come in the office and say, here's my last lab results. And so just simplifying that and having one place that they can go to, and, you know, if they're going to a different consultation, they can open that up, share that information. That allows to the strength of the interaction that we have with our clients, because that communication is clear. And so, you know, I think that all of this feeds into that same concept, that it's clarity, it's, you know, sort of connectivity. And then, you know, that just, for me as a provider, is super fulfilling. And, you know, my feedback from my patients has been exactly the same too. So, you know, I think that, you know, you guys are up to something really good here, to be honest with you, is I guess my final thought on all of that. You know, I think that there is not anything else on the market that is giving this type of tool for patients and for providers. So I think that's really remarkable.
Thank you, Dr. Jake. You know, just one more question here, and then we'll transition out. But You've got a model where you actually are checking in with, you mentioned 4 to 6 weeks you're seeing your patients, but there's also report cards that go out, is my
Right.
understanding, on a more regular basis. And you've also set up a really nice team of coaches that are helping
Mhm.
with a lot of the day-to-day. And I think that's one thing for practitioners who are listening about how do you really get this started. It's not something that Dr. Jake has time to look at every single day and pluck these signals out. Rather,
Right.
he's put a team in place that can handle a lot of that stuff, maybe escalate things to you, Dr. Jake, if
Yep.
something goes out of range. But they're also doing those check-ins between that 4 to 6 week visit. So could you just share a little bit about how that model works?
Yeah, sure. My
It's the
practice is,
code, I think. It's a very effective way to do this kind of medicine, and you've really cracked the
yeah.
code on it, in my opinion.
So we have a key group of metrics that we like to pull each week. And so my assistant, whose job is to do that, is running a report for every client. And then we have weekly calls where we end up meeting, we text with the clients, but they come from me. And so I actually text every client and I'll say, hey, how's your week going? I see that your data looks great. I noticed that, your sleep is up and your activity is on fire. How are you feeling? What's going on? So that's sort of like one of our routines that we have. But you're right, it does take somebody who is compiling that information and kind of presenting it. So that way I can ping the person directly, and we can be efficient about it, because it would be impossible for me to collect that, and then reach out to everybody. And then when we see clients, the same information is then regenerated during their visit. And so it kind of goes into the HPI of the visit. And so now that data is part of the visit as well, too, as a report over the last, week or so. So there's kind of like a dual effect of being able to collect that data, and really having somebody who is expert in all of the devices, how to set them up, troubleshooting issues, somebody could text, and any time of the day, is really what I think makes it more successful, because people, they get overwhelmed. Even young people, have a hard time like getting their Wi-Fi to connect with a scale. So having somebody that's available to help with that adds to greater success. So it's
Troubleshooting.
It's an investment, right? But when I look at the return on the investment, paying somebody who's dedicated to do that, and then what we get from that, my clients have so much better success. They feel much more involved and connected. They take their app and they go out to dinner and then they show it to their friends. And so they're like, wow, look at what my doctor is doing. Look at all of this data. Look, I get my Oura right here on this one dashboard. I think that that's where, the real secret sauce is. But there's a lot of organization to it. And it takes a lot of sort of specificity. So I think it's really best suited when you have the time to spend with the clients. In traditional medicine, I know a lot of people are pressed for time and they have to kind of space appointments very rapidly. This type of practice definitely is better lent to longer visits and more significant time per patient. So if people are looking to maybe transition their model from a insurance based model, or going out of insurance, these type of measures can easily justify that, and be a good guarantee for the success of that type of practice.
Awesome. Thank you, Dr. Jake. So just a couple things here to get back to our slides. There's one more question we wanted to check in with everybody on, and that one is, let's see, what did we have in poll question number 3? So if you're interested in learning more about Oura Ring in practice, and if you want to schedule a demo with us, if you chime in here, we'll have our team reach out to you guys. And then while that's rolling, if you want to go ahead and schedule with us, you can. This QR code will let you schedule a visit with us. This is the discovery call. We can go into more detail about what you're trying to accomplish and how we can be of service to you in your practice with everything we've talked about here today. So I'll leave that up for a minute. We'll leave the poll up for a minute. And then the last couple things I want to cover here, I'll stop the share again. But Aaron, if you're on, if we had any questions from the chat that you want to bubble up while we have everybody here? Fire away.
That's right. Yes, I have a few here for Dr. Jake. One is from Angie, and it is Dr. Deutsch. Can you give any pointers on health coaching team side, like building the team ROI, a path to profitability, and best practices and pitfalls to avoid?
Yeah, I think I kind of gave a little bit of that there, so I don't want to be redundant in the last part of what I spoke about. So maybe it was just timing there, but I think that the ROI is clearly there. I hired a medical assistant who wasn't a traditional medical assistant. She was actually going to medical school, was taking kind of a gap year. So it was like looking for somebody who has a little bit different approach and maybe sort of long-term career, which was helpful. And then I have a nurse as well. But I think all of the members of the team have to kind of all know the same information. You know what I mean? They have to understand what we're looking at. They have to understand the terms. They have to understand the devices, because they're not going to just focus with talking with that one medical assistant. They're going to say to anybody in the team, hey, what's going on with my app? Or, hey, why do I have this, weird dip in my blood sugar? And so like, it's really important to empower the team members to all be participants. And then also like kind of teach them when to react and send it back to me. Like, oh, that's really interesting. Let me make sure I get the right information. I'm going to ping Dr. Jake. And, that's, I think, one of the key points as well for that. Did I get all those questions? There's a couple of things on there.
Yes, you got them. And this one is for Dave. In regards to HIPAA, are there HIPAA considerations with the flow of data when using Heads Up Health?
Yeah, so we are HIPAA regulated just like any other health system or healthcare provider. You actually can't even sign up for our system without agreeing to our business associate agreement. And then the data is exclusively between you and your clients. And so we're just crunching your own information and visualizing it for your own patient. So we're regulated just like any other entity under HIPAA.
Awesome. And Regina says, Dr. Jake, do you have a branded app that pulls the data in?
Yeah, so we're using a white labeled version of Heads Up. So when my clients log in, it says our logo, which is great. So I think that adds tremendous value because the first thing they say is, "Oh, you have an app," and yeah, we do, but I didn't have the engineers to build it. That's what was really, all of the data comes to the Heads Up platform, and then we have different signals and reports that we run to grab that information.
Awesome. Chrissy, this one's from Chrissy to Jason. Is Oura FHA and HSA available?
That is a great question. We launched HSA, FSA availability towards the end of last year. And, to be totally honest, it's been way more successful than we even expected it would. And I think what we're really excited about with it is just this idea of making Oura more accessible to more people. And we've certainly seen that happen through the launch of HSA, FSA.
Love that. Okay. And we have one from...
One more, Aaron, and then we got to do the giveaway.
Okay. We've got Talitha says, is anyone utilizing Oura Ring with Heads Up specifically for women's wellness, hormones, and cycling? Talitha, I'll tell you, I use it personally for that. I've been using Oura and Natural Cycles for a few years now for that. But in regards to practices, Dave, that one's for you.
That's not we don't see practices specifically with that use case. I know there's other partners that Oura has that are specifically targeted to that application. You mentioned one, Aaron, Natural Cycles, or maybe others. We're not seeing a tremendous amount of it on our system. We're more working on other types of concierge integrative programs. So it's not one we see a lot, but Jason, I think you can probably validate that is actually a very strong use case for Oura as well.
Completely agree with that.
Yeah, you could definitely monitor that through Heads Up, especially if you're going to add glucose in there. It helps to see those cycles. And we've got Dutch and hormone panels that you can pull in as well to monitor all of those together through Heads Up. Okay, that is it for questions. All of those questions that are left in the chat, I will reach out to you personally.
All right, I'm just going to scroll through the list here, and if I call your name, just ping Aaron in the chat, and I'll start drawing names until we find a winner for the ring. And the first one is Nicole Homan. Homan? Homan? I can't see the chat, Aaron, so let me know if Nicole pings you.
Nothing from Nicole. Nicole, if you're out there, shoot us a message in the
Nicole
chat.
going once, Nicole going twice, Nicole going
she's
3
here.
times.
Hi, Nicole.
All right, boom. All right. So, Aaron, can you make sure you get Nicole's contact information? We'll send her a sizing kit, and we'll send her a ring.
Absolutely. You're the winner, Nicole. So I'm going to email you specifically to get your details for shipping that your way.
And Dr. Jake, for Oakwood, can you give us some information on how to find your website and other ways to get in touch with you if you have options?
Yeah, sure. It's oakwoodprecisionmedicine.com. And you can email me, drjakedeutsch@gmail.com. Or if you're a big social person, you can follow me on social media. My Instagram is drjakedeutsch.
All right. Well, there's tons more we can cover here, but hopefully this gives everyone some inspirational ideas on what's possible with Oura and the biometrics it provides and how to start using this in practice. We'll follow up with the recording from the webinar. If you have any other questions, you can reach Heads Up, support@headsuphealth.com, and we'll follow up with everyone after the webinar gets cleaned up and published. So thank you for taking time out of your busy days. We're very grateful. And I think we're done here. Aaron, John, anything else? Dr. Jake?
One last thing, because we do have a couple last minute questions, as if you would like to get rings for your practice and you are a member of Heads Up Health, we can do that and we can get you a discount. So Greg, Julia, I've seen a lot of questions come through about how to get those. Book a demo with us and we'll walk through that.
Thanks, everybody. Have a wonderful day. Thank you, Dr. Jake.
Thank you, everybody.
My pleasure. Thank you, everybody.